Scanning the room.
Hi, my name is Jocelyn Invernon. I'm a PN student at Williston State College, and for my skills today, I'm going to be doing a pediatric head-to-toe assessment. So I'm beginning outside my client's room, and I'm going to enter. So, knock knock. Hi, my name is Jocelyn. Today I'm going to be doing the assessment on Charlie here. Can I just have you verify your name and date of birth? Charlie Lippincott, 3/24/2013. Awesome. Hi, Mom. It's so nice to meet you. I'm going to go ahead and perform hand hygiene before I begin and make sure the door is shut and the curtain is drawn for privacy. So to begin, I know that my assessment always starts by the first time I lay my eyes on my child. Mom is falling. So I'm noting that my child is having no problem hearing me. She is following me around the room as I'm walking with her eyes. And first thing I'm going to do is gather health history. So I'm going to ask Mom, is Charlie on any medications that we need to know about? No medications, just a daily vitamin. Okay, I'll make note of that. Is there any family histories that, any diseases, any problems there? No, family is very healthy. Okay, what about any surgeries? Charlie's had no surgeries. Okay, perfect. So I'm going to go ahead and begin my head to toe on Charlie here. So first thing I would do is get a weight on Charlie. I would have her walk over to the scale, and while she was doing that, I would note her muscle mass, the fluency in her walk, and I would have her sit back in bed, and if she was under 2, I would know that I'd need to get a head circumference, but she is 5, so we don't need to do that, but if so, I would start at the brow line and wrap around the largest part of her skull. Next, I'm noting symmetrical. Her eyes are symmetric, her ears are symmetric. I know that I don't need to do anything quite invasive because she's had no surgery such as a tonsillectomy, and same for a neuro check. It's not ordered, so it's not necessary. But I am going to go ahead and note her throat. I don't see any bulging of the lymph nodes or thyroids. Her trachea looks midline, so there's no deviation there. Charlie, are you having any pain anywhere? No pain today. That's good. Does Charlie typically have this type of demeanor? Okay, good. So she's seeming normal today, no problem there. So I'm going to begin by listening to Charlie's lungs. So Charlie, I'm going to have you sit up and I'm going to take a listen to your back. Okay, do this the best that I can. I'm going to listen to both lung fields symmetrically, noting any wheezing, stridor, crackles. I'm going to count respirations for 1 full minute as well. Noting her breathing as she's doing this. Everything sounds good in her lungs. There's no wheezing, crackles, nothing, no labored breathing. I don't see any nasal flaring, which would indicate labored breathing. Charlie, you're not having any problems breathing today? No problems there. So I'm going to go ahead and move forward and listen to your chest now. So I know that I'm going to listen to her apical heart rate for 1 full minute and also listen for any extra heart sounds. So Charlie, I'm going to go ahead and go under your gown here and listen to your heart. Listen for 1 full minute, but for the purpose of the video, I'm not going to. I'm noting any extra heart sounds, any murmurs, and everything sounds good. I know that if I did happen to hear a murmur at this age, it's typically innocent, nothing to be too alarmed over. It's common. So next I'm going to feel for a radial pulse and a brachial pulse, and I would assess those for a full minute each as well. I'm going to next move down to my client's abdomen. So I'm going to have Charlie here lay down. Charlie, I'm going to pull your gown up and look at your tummy. So I know when doing this, I would go ahead and ask Mom, is Charlie having any elimination problems? Nothing out of the ordinary. She's pretty regular, okay? And how about eating and drinking? She loves her food. Okay, good. That's awesome. So I know that I'm going to begin by always observing, auscultating, and then palpating. So I'm going to look. I'm going to assess her breathing. I don't see any rib retractions. I don't see anything out of the ordinary. So next I'm going to go ahead and listen to bowel sounds. Okay, Charlie, I'm going to listen to bowel sounds here in all 4 quadrants. and bowel sounds are present in all 4 quadrants. And next I'm going to lightly palpate. While I'm doing this, I'm going to assess for any signs of pain, any grimacing on my client's face, feel any guarding. And I'm not noting any of that. So now I'm going to go ahead and move down and assess my child's skin. So while I'm doing this, I'm just going to note if I see anything that could indicate child abuse, bruises in various stages of healing, anything of that sort. I'm going to look at clubbing on the fingers. I don't see anything that would indicate clubbing. Her nail beds are pink. Her capillary refill is less than 2 seconds, and that is great. Same for her feet. Cap refill is good. Toes look great. I'm going to go ahead and check pedal pulses here. And they are strong, bounding, and equal, both feet, and that is good. So I'm gonna go ahead and finish up my assessment by asking Charlie and Mom about the genitalia region. I would ask Mom if she's noted any rashes, bleeding, any swelling. There's nothing out of the ordinary. And I would note that if my child was approaching the age 10, to ask about the start of a cycle, but she's not quite to that age yet. And the last thing I would do is my vital signs. I would take a tympanic reading on my client in her ear, and I would also take a blood pressure, making sure that the blood pressure cuff is 2/3 circumference of my client's arm. And I would just go ahead and end the assessment by making sure, letting the mom know I'm going to go plot and plot Charlie on the growth chart, come back with the information from that, finish up documentation, and leave the room.